Time for a Health Watch, and as always, we are joined by our friend of the show, Dr. Syed Hussain of Trinity Health of New England. Good morning.
Morning.
And welcome back.
Thank you.
We have a couple of topics to jump into this morning. First up, we're talking about some diseases that were previously eradicated, but they are starting to make a comeback, like measles. That's been in the headlines lately. So what is leading to this current surge in 2026?
Yeah, let's talk about a few of these conditions. So measles is top front and center. South Carolina actually is in the mid-symphony of the largest outbreak we've had of measles, a little under 800 confirmed cases so far, since 2000. Now, 2000 is when the United States declared itself measles-free, that measles had been eliminated, but unfortunately we've had several outbreaks since then, and a large number of outbreaks, especially in Texas last year, with over 700 confirmed cases. We've seen 3 deaths in the U.S., including 2 children. The bottom line here is folks need to get vaccinated. A large chunk of these cases, confirmed cases, are in unvaccinated people. And it's incredibly hard when you see children get impacted because measles, folks need to know this, measles is not chickenpox. Measles can lead to very dangerous complications, including death. And you can see complications even much later on after measles infection. It is a vaccine, 100% vaccine preventable disease. There are 2 shots that are recommended between the ages of 1 and 6, and it confers 97% protection from measles infection. So if you haven't, please roll up your sleeves. If you suspect you're in an area where there's a measles outbreak, please reach out to your healthcare provider. There are steps that can be taken, including a 21-day quarantine. But it's really, really important that we stop the spread as much as possible. A couple other conditions that we need to keep an eye on: avian flu. Avian flu, just for viewers to remember, was responsible for the devastating 1918 flu pandemic that we saw. So need to keep an eye on that. And then in Africa in particular, those viruses that cause viral hemorrhagic fever, which are very devastating, high mortality, Ebola, Marburg, those all need to be considered as well, and just to keep a close eye on them.
Okay, good to know. Next up, a lot of folks are, we'll say, diet conscious these days, and there's a lot of misinformation. One of the most popular diets getting a lot of attention right now is the keto diet, but it turns out that it may not be the best for some folks in the long run. So tell us why that is and why people should care about the long-term effects and not just quick weight loss.
Yeah, let's talk about this. So there's an interesting study out from the University of Utah. Study dealt with mice. Not all things translate to humans, but the important thing, bottom line here, is mice were put into different categories of diets. Those in a ketogenic diet actually showed higher incidence of fatty liver disease, blood fat levels that were higher, and impaired glucose tolerance, which means their body was really not conditioned well to take in carbohydrates when they were reintroduced. All of these are red flags because we don't know the long-term, to your point, effects. So if you're considering a ketogenic diet, please talk to your healthcare provider. You may have underlying medical conditions that can tip the balance. So you always need to weigh the pros and cons.
All right, something to keep in mind. Don't just go with what you see everyone else doing.
That's right,
on
especially
social
what we
media.
see in social media.
Yes.
Great point.
Yes.
Yes.
Okay, we do have time really quickly for one more topic. We want to talk about night owls. Some people love staying up late, but it can be bad for heart health, right?
Yeah, this is a study, observational study out from the UK, looking at 300,000 people, data points related to them over 14 years. And those that are night owls tend to do worse in terms of cardiovascular outcomes and health compared to the general population that may have more normal sleeping patterns, or those that are early risers, and they go to bed early, wake up early.
That's me.
So that's good, yes. But the night owls in particular, those that stay up late. And when you think about what the body goes through, the internal body clock is primed to make sure that the body gets rest at nighttime. Melatonin's released, stress hormones go down. So we're going against the natural cycle of what the body wants to do, and so that may have an impact. This is an observational study. It's not causation, it's association, but all things to keep in mind.
All right, thank you so much for joining us.
Sure.
And we'll see you back here next week.
Absolutely.